Good day. This is Dr. Homer Lim, the Concerned Doctors and Citizens of the Philippines. I'm also the Medical Director for Crisis Holistic Health. So on this particular segment, I'd like to talk about vaccines in children. I think this is the worst thing that we can be considering now in the Philippines, vaccinating kids. Um, there's a small study. Yes, there's a small study in the United States wherein they use Pfizer. You can actually go online, no? You can search this, wherein they saw that uh, kids now vaccinated from those from 12 to 17, okay, 12 to 17. Ano yung adverse reaction nila? Twice, twice the normal, okay, twice the normal of those who were uh, vaccinated placebo. So yung adverse events ng kids, no, of those who had severe, so when we talking about adverse events, we're not talking about the mild. We're just talking about severe adverse reaction requiring hospitalization, no. So those kids who were vaccinated, okay, between those 12 to 17, you can look it up. Uh, the adverse reaction was twice as much as those who were just given placebo. And just to think how many kids actually go to the hospital and actually die from a COVID infection. Okay, so I think we have to be more careful and discerning. Why would we need to vaccinate kids now? Number one, kids, if they do develop a COVID infection, it's very mild. Number two, if kids do get COVID, what's the chance of them transmitting the virus? Very low. Number three, if you vaccinate them, how about those who needs the vaccination more than the kids? Those who are, what we call yung comorbidities, yung mga may sakit. So, uunahin mo pa yung bata more than those who really need the vaccine. So, I think we have to be more discerning and, honestly, why would you want to vaccinate? To those policymakers, I just like to ask the question, would you even experiment this on your own kids or your own grandchildren? I think we have to really think about this. To say that we need to vaccinate everyone so that we will be safe, I think data has been showing that it's not true. If you look at the vaccination rates in Israel, in Seychelles, in Seychelles, I mean, they in Vietnam. Look at them. Vietnam before vaccination, okay, right? They have very low rates. Now they had been vaccinated, and look at them. They're on lockdown. Okay, so I think to say that we need to vaccinate the whole population just to be safe, I think that is a quite a wrong statement now. Um, I think we need more data on this, but to vaccinate kids, really. In fact, FDA already came out, US FDA came out with a advisory that children who have been vaccinated with the mRNA are more likely to develop heart inflammation, yung myocarditis, yung namamaga ang heart. So, I think that's already a clue that why do we have to risk kids? Okay? In fact, yung chances, okay, of course, yung mga bata, bakit sila nagkaka-myocarditis? A lot of children who develop myocarditis are those who had tinatawag nating viral infection. Virus din. So most of the time, it's what we call the Coxsackie virus, no? And some of them adenovirus. So they develop myocarditis. So what is the event rates of kumbaga yung number of events per million kids is around uh, 6 to 8 per million. Okay? However, vaccinated kids, okay, so this is their data. This is data based on the US FDA rates of adverse reaction or yung tinatawag na myocarditis. They were 66 more times more likely to develop heart myocarditis or inflammation ng heart. So just that alone, I think we have to be more, discernful about should we really vaccinate kids. I mean, this is a very, how do you say, very very important thing to consider because, as what Sir Rizal said, the kids, ang kabataan, ang pag-asa ng bayan. If we do this to our kids, what will happen to our country? So I think we have to be more uh, careful and really look at what are the advantages, and we know that the advantages are outweighed by the risk of vaccinating children. So I'm pretty much concerned that this is even being talked about and being pushed by the government. I think we have to be really careful about this. Thank you once again. This is Dr. Homerlim of the Concerned Doctors and Citizens of the Philippines.